So what exactly are kidney stones?
So kidney stones are formed by crystallisation of salts in the urine. They form in the kidney, and then often they just sit there asymptomatic. They don't cause any trouble until suddenly they drop into the ureter, and then they can cause severe pain in the back, radiating down to the groin. It can often be associated with nausea and vomiting, or even blood in the urine. They're really common. Up to 1 in 10 lifetime risk of getting a stone, slightly higher risk in men than in women.
So they quite literally are like little pebbles or stones that our bodies have
literally are like hard little stones. They come in different shapes and sizes, and most of them are calcium-based stones.
So who gets kidney stones?
So kidney stones are really common, and they can occur at any age, although your risk does increase with time. Although we do even see stones in children really occasionally. The lifetime risk of getting a stone is about 1 in 10, and there's a slightly higher risk in men than in women. We thoroughly investigate these patients to find out the cause of the stone, although often the cause is really dehydration more often than not, so not drinking enough water. To prevent stones, we encourage patients to aim for about 2 litres of fluid intake per day to try and minimise their risk. We analyse, where possible, the stone composition to look for dietary causes. There are some basic things you can do though to minimise the salt intake in the diet, as well as adding some lemon juice in the water, which often makes it a bit more palatable, but it can also reduce the risk of further stone formation.
And what about recurrence? So if I've had kidney stones once, are they likely to come back?
Unfortunately, if you've had a stone once, then your chances are approximately 50% over the next 5 years of getting another stone. So drink plenty of water.
So what happens when someone presents to the emergency department with pain from a kidney stone?
So these patients often have very severe pain. The first thing that we need to do is get their pain under control. Once that's achieved, often the safest thing is really just to unblock their kidney to allow the urine to drain through, which will relieve the pain, and we do that by placing what's called a ureteric stent.
What's a stent?
So ureteric stent is a small rubber tube which sits with one end in the kidney and the other end in the bladder, and that does a number of things. That allows the urine to drain out safely, which is really important, particularly in patients who've got an infection. The second thing it does is that these stones are really jammed in tight in the ureter. That's why it hasn't passed on its own, and that stent allows the ureter to soften up. We leave that internally for a week or two, and then as a secondary procedure it's much safer to come back and then deal with the stone definitively.
So you mentioned that these patients might have to have a stent in their body for 1 to 2 weeks. Is there any complications or possible issues that they might face or need to be aware of when having these inserted?
Yeah, so stents cause symptoms for most patients to varying degrees. The things that I warn patients to keep an eye out for is that they will feel as though they need to go to the toilet often because the stent irritates the bladder. Most patients will have some blood in the urine, and whilst it might be alarming, it's nothing to worry about, and they just need to keep up their fluids. And thirdly, patients often get a bit of discomfort in the back, but it's never as bad as the original kidney stone pain. We only use stents when we really need to, and we make every effort to limit the time that they need to stay in place.